Alzheimer's disease, commonly referred to as Alzheimer's dementia, is a progressive neurodegenerative disorder that slowly invades the brain. As the disease advances, patients not only experience declining memory but may also face challenges with language, mood regulation, and performing everyday tasks. Although medicine has yet to offer a complete cure, early detection through scientific screening and proactive intervention can significantly slow symptom progression, allowing seniors to enjoy a higher quality of life. This article highlights several common early indicators and explains a practical self-screening method designed to help you and your family monitor an elder's health for timely intervention and prevention. 1. Gradual memory decline, short-term forgetfulness as a warning sign. In the early stages of Alzheimer's, changes in memory function are often the most pronounced. Many seniors who once had sharp memories might now frequently forget recent events. For instance, Mr. John, who used to diligently keep track of his daily schedule, has recently begun to repeatedly ask about prearranged activities and even forgets details of stories he just told. This isn't merely ordinary forgetfulness, rather, it signals an early impairment in the brain's ability to store and retrieve short-term memories. Moreover, some families mistakenly chalk up occasional forgetfulness to natural aging. In reality, early Alzheimer's patients tend to have significant difficulty recalling recent events while still retaining long-ago memories. This new loss but old retention pattern is a crucial clue in identifying the disease. Family members should take note whenever a loved one persistently repeats the same question, as it may be an early sign warranting close observation. 2. Language difficulties, communication hurdles. Beyond memory issues, language difficulties are a common early indicator of Alzheimer's. Patients may struggle with word finding, exhibit broken speech patterns, or constantly self-correct. For example, Ms. Emily, who is normally an eloquent speaker, has lately begun to pause abruptly and repeat words when recounting past experiences, as if her thoughts are momentarily stalled. Additionally, these patients may also experience delays in processing spoken language, often misunderstanding what others say. This goes well beyond the occasional slip of the tongue due to distraction. It signals that the brain is having trouble handling linguistic information. Caregivers should observe these subtle speech changes, document any deterioration, and consult a healthcare professional if the issues persist. 3. Emotional fluctuations and social withdrawal, the silent cry. Emotional instability and altered behavior can also serve as early warning signs. Some patients gradually lose interest in their surroundings, becoming withdrawn and even developing distrust or suspicion toward people they once trusted. For instance, Mrs. Karen, who used to engage enthusiastically in community events, has recently started isolating herself at home. She not only becomes moodier and more erratic but sometimes feels inexplicable anxiety, at times even suspecting that her family is withholding their love. These emotional and behavioral changes can deeply impact her mental wellness and place additional stress on family caregivers. It's essential for loved ones to spend extra time with her, closely monitor these shifts, and, if necessary, seek professional counseling and behavioral interventions. 4. Declining daily function, when routine tasks turn challenging. As Alzheimer's progresses, seniors often experience a noticeable decline in their ability to handle everyday tasks on their own. Activities that used to be simple, such as cooking, shopping, or household chores, can become challenging due to forgetfulness or operational errors. Take Mr. David, for example. Once an independent individual, he has started forgetting to turn off the stove, mixing up ingredients while cooking, and even making mistakes when dialing phone numbers to order food. These lapses not only increase the burden on caregivers but also pose serious safety risks. Family members should remain alert to any significant decline in fundamental daily skills and intervene when needed to keep the elder safe. 5. Self-screening, the clock drawing test. For households concerned about early cognitive decline, one simple and practical self-assessment tool is the clock drawing test. This test offers an initial glimpse into the patient's spatial awareness, planning ability, and overall executive function. Follow these steps to conduct the test at home. Draw the clock face. On a clean sheet of white paper, use a pencil to draw a closed, as smooth as possible circle. If you produce a reasonably circular shape, award yourself 1 point. Label the numbers. Inside the circle, write the numbers 1 through 12 in sequential order, approximately where they would appear on an actual clock. If the number placements are correct, add another point. Draw the clock hands. Following the instructions, draw distinct hour and minute hands indicating a specific time, for instance, 10:30 or another designated time. If the hands accurately point to the proper positions for the chosen time, you earn an additional point. Scoring guidelines. 3 points, indicates that cognitive function is likely within normal limits. 2 points, suggests the possibility of mild cognitive impairment, further observation is recommended. 1 point, or less, may point to moderate or more advanced impairment, necessitating a prompt professional evaluation. While a definitive cure for Alzheimer's disease remains elusive, early detection and timely intervention can slow its progression considerably. Family members should be vigilant for repeated memory lapses, language difficulties, emotional instability, or declining personal care skills in their elderly loved ones. Remember, self-screening tools like the clock drawing test are only preliminary measures. If you notice signs of cognitive decline, contact a neurologist or a specialized memory clinic immediately for a comprehensive evaluation. Early diagnosis and treatment can not only reduce the patient's suffering but also afford the family greater peace of mind. Additionally, while monitoring your loved one's health, consider establishing a support network with other families and community resources. Sharing caregiving strategies and forming support systems can create a meaningful impact, ensuring that every elder enjoys dignity and security in their later years. Each faint sign, from fleeting memory loss to halting speech, conveys vital information about brain health. We hope this guide helps you identify risks early enough to preserve your loved one's precious golden years. If you're concerned about the cognitive health of an elder in your family, please seek professional advice without delay. Note: this video is provided for self-screening purposes only. For a definitive diagnosis, a professional evaluation is essential. If you have any concerns, contact your healthcare provider immediately for an accurate assessment and appropriate guidance.